Hi, I'm Virginia from Right Clinic. I've been a medical writer and content creator since 2020. And I've also been a registered pharmacist since 2014. So in this video, we're going to talk about the difference between Hemingway app and also a new readability tool that you may have noticed if you've clicked on the link in Medical Writer magazine. So just so you know, if you haven't seen Medical Writer magazine before, this is what it looks like. And on page 33 down here, there is a little paragraph that says new and free readability tool for you to try. And so while I was working at the Patient Information Forum, which is PIF, P-I-F, I met Jill Rowlands from Newcastle University, and she's been working on a new readability tool specifically for people who write health information. So that's what we're going to be looking at today. So if you're not familiar with readability tools, then a readability tool lets you know how easy your writing is to read. And that could be by someone who is maybe 10 years old or younger. And the thing about readability tools is, even though they want you to write short sentences, which are easy to understand, and they don't have any long words, and they don't have any sentences or paragraphs, which are super long, one of the nuances with using a readability tool is that you need to decide as a medical writer when the writing is clear or not. And you do not need to follow all of the rules. So this is where style is really important as a writer, and you need to really know your audience as well. So not all pieces of writing are made for people who are a very young age. It's that people who read the writing may not have a level of English which is of older children, or not be able to understand the level of English of older children. So when it comes to academic writing, we say that reading age is usually about 16 to 18 years old. But when it comes to health information for patients or people who may not have English as a first language or not be able to speak English at all, then we tend to write for a reading age of about 8 to 11 years old. And that means that someone who's 24, who's feeling really ill, might not be able to understand complicated health words, and their health literacy might be really low. So health literacy is their ability to understand difficult health words that we use all the time as medical or health writers. And our job is to explain things clearly so people can make health decisions and understand health information. So this is what Hemingway app looks like. I'll just show it to you, and then we can compare what it looks like to this new tool. So this is what Hemingway app looks like. And when you write things, it will highlight hard sentences in red. So you can see this is a hard sentence because it's very long, very hard sentence to read. And then there's this yellow sentence, which is also hard to read. So it's quite long, but not as long as the red sentence. And then it's got things like weakeners, which are usually adverbs. And then there's also some words that might be highlighted, which have a simpler alternative. Now, we're not going to go through the advanced features of Hemingway Editor, which includes AI tools and things like feedback. And this is an online version that's totally free to use, so I'll link it in the description below. And you can see here the readability is grade 8. And usually when we want to lower the reading grade, that's what we do in healthcare writing. And we usually write about grade 6 or so, or lower if you can. So now let's look at the new tool. So I'm going to stop sharing that one and share the new tool. And again, this is being developed. So if you do have any feedback on this tool, then it would be great if you can email that to me. Here we go. So when you enter this new tool, it will say, welcome to the NHS document readability tool. So this is based on the NHS style guide. And here it says the average reading age of adults in the UK is 9 to 11 years old. Information we write often has a higher reading age than this. This tool helps you write in a simple and clear way for the average UK reading age. So you need to respect that not everybody will have the same level of education. And then it says how to use this tool. So copy and paste some text that you've written into the tool and make edits or start writing something new directly into the tool. So it works in the same way as Hemingway app at the moment. So use the options on the right-hand side to find out the reading age of your text and find out what might make your writing hard to read. And then edit your text and see the reading age change. So once you finish, copy and paste your text from the tool into a Word document or email, etc. But please note that the tool does not check for spelling and grammar mistakes. You will need to use another program to check for these. All right, so let's copy and paste what I've got. So here I've copied and pasted something which says, what happens if I take too much vitamin A? And you can see already it's highlighted a whole bunch of stuff. And so the first thing is that it's given me an estimated UK reading age of 16.9, which is quite high. So it's given me an orange color for the reading age. And then it's got an average reading time of 25 seconds. And it's also said to include medical terms in the reading age scores. So if I remove them, then the reading age goes down slightly. So sometimes you'll have to have medical terms in your writing, and that can increase the reading age without you wanting it to be that way. And so it's nice to have that function that you can toggle on and off. So sentences that are in dark pink will be complex sentences. So I need to try and simplify these sentences. And then there are passive sentences. So when you have a passive sentence, that means that it's difficult to read. So you want to make sure it's trying and make it an active sentence. And then you've got complex words, which are highlighted in green. So these are probably just long words. And then there are long words, also highlighted in purple. And then you've got a summary here of characters, words, average words per sentence, sentences, and average sentence per paragraph. So let's try and have a look at what I can do differently here. So this is osteoporosis, so I can't really remove that. And here I've got multivitamins, I can't remove that either. So let's try and shorten the first sentence. So some research suggests that having more than an average of 1.5 milligram or 1,500 micrograms a day of vitamin A over many years may affect your bones. Maybe I can actually just make that full stop, but it's still not good enough. So I'd have to try and shorten it even more. So the other thing I really like about this tool is that if you write a medical term, so for example, cardiovascular, then it will suggest an alternative. So here I've written cardiovascular, and then it's got a little bubble that says heart and or blood vessel. So I'll click on that, and then I'll select the term that I mean. So I mean heart, rather than the blood vessel, which is the vascular part of cardiovascular. And that's a really helpful tool because I think some people who do not have a medical or health background that want to get into medical writing, it can be a challenge to understand all of these words. So it's nice to know an alternative. So another example is, for example, hypertension. And so it's highlighted that word as well. And here it says blood pressure that's too high. And then in brackets, it's got blood pressure that's too low, just in case you mean the alternative. So I'll click that, and then I'll just select which one I mean. So blood pressure that's too high is what I've selected. So this is a pretty useful tool, and I would say you should check it out and see what you think of it. And I will leave a kind of email that you can email me about any feedback that you have. And thank you so much for watching. And if you haven't seen Medical Writer Magazine already, then I'll leave a link to that as well. So let me know what you think. I hope you enjoy reading, and I'll see you in the next video. Bye.